So the most common indication that we take tonsils out now in children, so that would be kids under the age of 18, is actually for something called obstructive sleep apnea. So what's obstructive sleep apnea? That's when kids actually have pauses in their breathing at night and stop breathing, usually due to obstructions from the tonsils and the adenoids. We have pretty strict criteria about how many infections you have to have a year to have your tonsils taken out. So our criteria are 7 infections in 1 year, or 5 infections a year for 2 years in a row, or 3 infections a year for 3 years in a row. These people get little tonsil stones stuck in their tonsils, which are literally like these little white, yellow pebbles that will come out of their tonsils. Sometimes it can cause bad breath. It can definitely cause irritation back there. Those are reasons that we would take out your tonsils. Other times, sometimes they're very large and they actually interfere with your swallowing. Or you could get an abscess called a paratonsillar abscess from a throat infection. Those would all be other reasons that we would consider taking